Does your dog have diarrhea and it just doesn't seem to clear up? Watch this video for everything you need to know. Hello everyone and welcome to Zoomies. Today we're going to be talking about diarrhea as a whole, everything you need to know, things you can do at home, things you need to watch out for, and when does diarrhea actually become concern. It's important to note that dogs live close to the ground. They investigate the world using their tongues and their nose, and it's inevitable that they will eventually lick or eat something that they shouldn't, or that might contain something that will inevitably lead to diarrhea.
This is especially true for puppies. Puppies are dumb. Puppies put everything in their mouth.
But sometimes the cause of this diarrhea can actually be very difficult to identify, and it seems to keep reoccurring. Why does that happen? So, diarrhea can basically be divided into two categories: acute and chronic. Acute is your way more common form of diarrhea, but chronic tends to be the more kind of difficult situation to be in. One of the main causes for diarrhea, especially in young dogs, is infection. This can be viral, bacterial, or protozoal. And yes, of course, it includes worms as well. Although not as common that worms are the cause for diarrhea, definitely the others. Another reason for why acute diarrhea may ensue could actually be because of drugs or medications that you may be giving, but also toxin ingestion. Not necessarily lethal toxins, but enough to just give them a bit of a runny tummy. And then probably the most common cause for diarrhea in dogs is stress. Stress is probably the most common reason for why dogs have diarrhea in the acute onset that I see in consultation. At least this is pretty easy to sort out. I just want to take this time to emphasize that if you have a young puppy at home, especially if it's an unvaccinated or new puppy that starts to show signs of diarrhea, please get this puppy to a vet so they can test specifically for a disease called parvovirus. This is a very lethal, dangerous, highly infectious issue that most often requires hospitalization, and even with treatment, the infection and the virus still has a high mortality rate in puppies. So now we're going to move over to more kind of chronic or repeated reoccurring causes of diarrhea. One factor to consider is actually dietary factors. This could be food sensitivities, food allergies, or even food intolerances, such as gluten intolerances and inflammatory processes that can occur from their diet. And yes, this also includes dogs that like to scavenge, that like to eat bird droppings or their own feces. It's called coprophagia. That can also be a cause for diarrhea. Obviously, this can lead to, but can also be a primary reason, inflammatory conditions. This includes things like inflammatory bowel syndrome, IBS, pancreatitis, gastroenteritis, very common causes for diarrhea in dogs. Just know that a lot of time with these inflammatory processes that there might actually be an underlying food allergy or food sensitivity, such as pancreatitis that is linked to fat sensitivities, and these dogs need to be on very low fat diets, such as schnauzers. Say that 3 times fast. Then you also have certain vitamin deficiencies. Vitamin B6 and B12 are very common and actually lead to a thing called malabsorption, maldigestion, that actually allows for diarrhea to ensue because of these deficiencies. And now we're kind of getting into the difficult territory. So now we're dealing with very chronic, very difficult to handle situations and causes for diarrhea. These could include endocrine or hormonal disorders. And examples of these is exocrine pancreatic insufficiency or EPI, diabetes, and thyroid issues. All of these can actually be chronic, reoccurring causes for why your dog might have diarrhea. And then just want to pop in there that I normally warn my clients about, and that's post-surgery or post-anesthetic. If your dog recently had a procedure done and they're not eating very well, they're vomiting and they might have a bit of a runny tummy, but you realize that they recently had surgery, that could be a cause for it. And then the morbid one. We never want to talk about this, but unfortunately this is a reality of the situation, especially in older dogs, and that is cancer. Cancer of the intestinal tract can actually manifest as unresponsive, untreatable, reoccurring diarrhea. So what I just wanted to put out there is acute diarrhea tends to be more in younger, naive dogs, whereas your chronic, reoccurring diarrhea tends to be more in your middle-aged to older dogs. So what can make diarrhea worse? Obviously, one of the reasons that can make it worse is actually more stress. Is your dog going through a stressful situation? How do they handle stress? Are they just a little bundle of nerves? Have you maybe recently rehomed? All these causes of stress can actually make diarrhea worse in certain dogs. Then obviously, like we mentioned, any sort of food intolerances or deficiencies. So actually, if your dog has, for example, a gluten intolerance and you keep feeding them sources of gluten in their kibble diet, that might actually exacerbate and relapse the diarrhea. And then for those that are feeding whole fresh foods, you know that fruits, well, certain fruits or excess sugar can actually also be a cause of diarrhea. So maybe pulling back on the fruits and maybe even sweeteners if you add in certain toppers to your pet's food. Remember, always avoid xylitol. These can also be causes of diarrhea. Then we move on to what will your vet do? If you end up taking your dog to the vet, what would the vet do with chronic diarrhea or even acute diarrhea? So a good vet will actually try and get as much information as they possibly can from you as the owner, a full history and a full physical examination. Once they've got all that information, they might actually proceed to doing what's called a fecal analysis. Here they try to identify certain parasites or bacteria that might be the cause of the diarrhea, but sometimes this actually progresses to doing additional blood tests as well. Remember, we spoke about endocrine disorders, and those can only be evaluated on blood, not on feces. But in difficult cases, it might actually progress to needing x-rays or abdominal ultrasounds or even a colonoscopy or gastroscopy. But then the question arises, when do I take my dog to the vet if they have diarrhea? So I've got some key points that I'm going to list, and if you see any of these points, I would advise my clients that you seek medical advice from the vet. Number 1 is blood in the stool. There's never a reason for why blood should be in the stool. It is never normal. And this can actually manifest as a dark, black, tarry diarrhea as well. This is an emergency. This needs to be seen by a vet. The second one is if your dog becomes really lethargic or shows other signs of illness like weakness or vomiting. This obviously can manifest as a certain disease, and the diarrhea is just a consequence of that. Another one, if your dog is showing signs of pain, is a big one. If they're uncomfortable, they're getting up, they're getting down, they're drinking excessive water. These signs of pain is also a reason for why you should be getting to the vet. And of course, the last one is that if the diarrhea isn't stopping, with your best attempts, with everything that you're doing right, the diarrhea just isn't responding to what you're doing, get your dog to the vet so that they may intervene with the appropriate medications. So, what are the biggest risks of diarrhea? The primary one would probably be dehydration, loss of fluid and electrolytes. A second point would actually be loss of nutrition, since the food isn't having time to be digested and absorbed appropriately. And number 3 is actually the loss of blood, if there is blood in the stool, which can actually lead to anemia, or could be a sign of a more long-term difficult situation that's starting. So what can you as an owner do at home if your dog has diarrhea? Here are some key points. Number 1 is allow access to clean water to as much as they want. Number 2 is actually to withdraw food for 12 to 24 hours and then reintroduce the food in smaller, more frequent portions. And an even better option is actually to allow them to eat a bland diet like boiled or cooked chicken, no added oils, nothing fancy, no salt, boiled chicken or any source of like easily digestible meat and veggies. Those are really good options to go for and allows the stomach to settle without overwhelming it or stimulating it too much. Number 3 is actually psyllium husk. Psyllium husk doesn't really do anything to treat the diarrhea, but does add bulk to the stool and actually hardens the stool to allow for less liquidy fluid diarrhea to come out. Number 4 is actually to give an electrolyte solution, whether you put it in the dog's water or feed them with a syringe. That's a really good option. Number 5, and this one I would actually do chronically, is a pre or probiotic. A good pre or probiotic really helps out to maintain a good, healthy, functional gut. And then number 6, if you do have any anti-diarrheal medication maybe lying around at home like diosmectide, that's a really good option to give. So it's important to know that just like humans, dogs are very susceptible to picking up diseases even with your best efforts. Even if your dog is on the best diet and you're the best carer, your dog is still susceptible to picking up pathogens that might cause diarrhea. So don't get disheartened. The best thing you can do is to pay attention, monitor your animal, and intervene when appropriate. With that, your pet should be fine. But that wraps it up for today. If you have any additional cool, helpful tips that you use to stop your dog of having diarrhea, please drop it down in the comments and let's share this knowledge. Let's all meet each other halfway, get all the best tips that people have. If you've gone through all the cycles and you know what works and what doesn't work, please leave it down below. Information is power. Until next time, cheers.